Hello everyone, my name is Keegan Marston. Today I've prepared a little presentation for you guys about iron. Today we'll discuss the importance of iron in our bodies, what roles it has, what happens if there's too little or too much iron in our diets or in general. Uh, and with that, let's just jump right into it and talk a little bit about what iron is and the recommended dietary allowances and the upper level intakes of iron. Iron is a mineral that is naturally present in many foods, added to some foods, and can be provided as a dietary supplement. There are two types of dietary iron, heme and non heme. These two types are found in animal products like meat, seafood, and poultry, whereas non heme is only found in plants or iron enriched foods. Uh, Down below on the left, we have the recommended dietary allowances table, and on the right of it, we have an upper level table. As you can see, for the upper level for male and female during most ages, it's between 40 milligrams to 45 milligrams. It also has a little list for women who are pregnant or in lactation. In a little bit, we'll discuss more about why it's important to distinguish why women in pregnancy and lactation need more iron or potentially are at risk for anemia. As mentioned previously, uh, sources of iron include, with heme and non-heme, include meat, poultry, and fish. But for people that don't have a desire to eat these things or they're not readily available, here's a list of plants that are high in iron. Where they can at least get the non-heme side of iron into their diets. We have spinach, lentils, kidney beans, figs, potatoes, quinoa, oats, pumpkin seeds, almonds, soybeans, peas, chickpeas, and Swiss chard, which I've never had before or heard of. But nonetheless, it is high in iron. If you want to learn more about that, if you are a vegan or you just don't like eating meat that much and you feel like you are iron deficient in some way or are recommended by a doctor, go to that website, theveganjunction.com at the bottom right. I have a little bit more information. So let's discuss a little bit about the major functions of iron. Iron is primarily a component of hemoglobin, which is important for the transfer of oxygen from the lungs to tissues. Iron is also needed for cellular function, growth, development, connective tissue, and synthesis of hormones. So, needless to say, iron is a huge component of our bodies, and without iron, we probably would not even exist or have normal cellular function. For example, myoglobin production. Myoglobin is another oxygen binding protein which is found in skeletal muscle and in the heart. The presence of iron in muscles gives them their rich brown appearance, and just like hemoglobin, myoglobin has a heme group at its core. This is where it binds and stores the oxygen, and so it's readily available for that energy production, for DNA synthesis. DNA is the basic building block of all cells in the body, and so to build up these basic cells, we need iron, and iron is also a component of neurotransmitters, which is the substances used by brain cells to communicate one with another. For the immune system, it's also an important part of the immune system as a whole. And so now that we've learned a little bit more about the purpose of iron in our bodies, let's talk a little bit about iron deficiency and ferropenic anemia. Now, anemia is defined as having a decreased amount of hemoglobin in the red blood cells, and iron deficiency is the most common type of anemia. The body needs iron to produce hemoglobin, so when the body doesn't have iron, the rest of the body cannot get sufficient oxygen. Iron deficiency is common, and people can experience symptoms for years before finally knowing this cause. It most commonly affects women during childbearing age because of blood loss during menstruation. Poor diet and intestinal disease can also contribute to ferropenic anemia. During the research for this project, I found it surprising how many people I know, especially women, that have actually had ferropenic anemia due to some sort of intestinal bacteria or blood loss through menstruation or various other things. It actually is surprisingly a very common thing. Iron deficiency symptoms include fatigue, dizziness, pallor. Pallor is another word for pale skin, hair loss, twitches, irritability, weakness. Pica. Pica is a very interesting symptom. It's this desire to eat clay or dirt or some form of iron-rich soil. Brittle or grooved nails, hair thinning, plumber, impaired immune function, pagophagia, and restless leg syndrome. Pagophagia is a form of pica. It's this compulsive consumption of iced or iced drinks. And so, if you know people with these symptoms, does not necessarily mean that they are iron deficient, because a lot of diseases like fatigue or dizziness are included in those diseases. But if they have something like pica or plumber, or something like pallor or pagophagia, these are more specific towards causes of ferropenic anemia include inadequate iron intake, pregnancy, blood loss due to menstruation, internal bleeding, and an inability to absorb iron. Pregnancy specifically, because your body produces more blood to support the growth of the baby. And so if you're not getting enough iron or certain other nutrients, your body might not be able to produce the amount of red blood cells it needs to make the additional blood. So for most pregnant women, it's actually common to have a mild anemia. Most iron comes from foods such as meat, eggs, and some other green leafy vegetables. Some medical conditions like stomach ulcers can cause internal bleeding, which can lead to iron deficiency. Excessive use of aspirin can also cause stomach bleeding. And even if iron intake is adequate, celiac disease or gastric bypass may limit iron absorption. Gastric bypass, because part of that is cutting out the intestine, and celiac disease, in fact, causes damage to the small intestine where iron, folate, and vitamin B12 are absorbed. And so the most common symptom of celiac disease is an iron deficiency. And that's the one way that you can actually diagnose a celiac disease. A good thing is that if you are anemic from celiac disease, the most simple cure of it is to stop eating gluten. And once you stop eating gluten, it would take around 2 to 18 months estimated for the nutrition to come back through the small intestine. And usually people are cured by then. Not of celiac disease, but of the ferropenic anemia. Most people at risk are women of childbearing age, pregnant women, people with poor diets, people who donate blood frequently, infants and children, and especially those born prematurely or experiencing a growth spurt. In vegetarian toxicity includes an increase of iron in vital organs and can increase the risk of liver disease, risk of heart attack and heart failure, diabetes mellitus, osteoarthritis, osteoporosis, metabolic syndrome, hypothyroidism, and hypogonadism. Iron overload is acquired by receiving numerous blood transfusions, getting iron shots and injections, or consuming high levels of supplemental iron, and can be a genetic condition. One of the most common genetic disorders is hemochromatosis. As a part of my interesting facts later, I'll talk about my family. Hemochromatosis actually runs in my family, and it was a very interesting part of our lives as we discovered that it's this genetic condition that runs in our family, and several members of my family actually have hemochromatosis, and I've personally got to see firsthand the effects of hemochromatosis in our lives. So here's a list of symptoms that someone with hemochromatosis might experience. Personally, what I've noticed amongst my family members, chronic fatigue, joint pain, abdominal pain, and depression were a very large part of noticing that they had hemochromatosis. It actually consumed my grandfather's life so much, this chronic fatigue and joint pain, that it finally pushed him to go to the doctor, and they tested him, finding out that he had too much iron in his blood, and diagnosed him with hemochromatosis. And he lived with these symptoms for years before even finding out that he had hemochromatosis. And so living with these symptoms, it can actually get way worse and lead to stuff like liver disease or heart attack or heart failure, osteoarthritis or osteoporosis in general. So seeing how my family suffers from hemochromatosis, in part it made me want to learn more about iron overload and iron in general, which is why I picked this topic for discussion. One of the interesting things I learned came from Penn State University, talking specifically about people from Celtic descent, which my family is of Celtic descent. And the article states carriers have a 50-50 chance of passing on hemochromatosis gene to each child. And so we have found that my grandfather, great aunt, uncle, and several of my cousins have been diagnosed with hemochromatosis. And I can say that it does leave all of them feeling lethargic and sore. I remember that a long time ago, there was a group discussion about you have to go to the doctors. Everyone has to go to the doctors to check their iron levels. I personally do not have hemochromatosis. Luckily, my iron levels are normal. But through the discussion in my family, we have found a lot of members of my family do suffer from it, and it does leave most of them feeling very lethargic. Iron's function in metabolism. Cells require iron for the production of ATP during oxidative phosphorylation. Used in iron sulfate clusters, the heme groups of the electron transport chain, iron helps make a proton gradient that causes ATP synthase. As mentioned before, iron is also required for oxygen transport. The heme group in hemoglobin binds to oxygen so it can be carried to the rest of the body. Most media coverage about iron is probably centered around the iron deficiency part because it is such a common disease. An article in 2017 from healthline.com talked about the potential dangers of iron deficiency and listed the most common symptoms. 10 of these symptoms being unusual tiredness, paleness, shortness of breath, headaches and dizziness, heart palpitations, dry and damaged hair and skin, swelling and soreness of the tongue and mouth, restless legs, brittle or spoon-shaped fingernails, and more frequent infections. Take-home message is to help people gain knowledge if they are iron deficient or anemic, so they can contact a doctor as soon as possible. Of course, if you experience or anyone experiences these symptoms, it shouldn't be automatically recognized as being iron deficiency. Should always consult a doctor first before doing any sort of supplementation or excess iron overload. As discussed, we already know it can happen if you have too much iron. Conclusion. Iron is a major component and important mineral to normal cell function and transference of oxygen. It is common among women to have an iron deficiency and become anemic from the lack of nutrition or blood loss. For this reason, it is important for people to check their iron levels if they experience any of the symptoms on a regular basis. Part of these symptoms is also symptoms of hemochromatosis. If people try to self-diagnose on either side, they are at risk for iron deficiency or an iron toxicity, and we know the outcomes of those. And here's my reference page that I've used during the presentation. Thank you guys so much for taking the time to listen to my presentation. I learned personally a lot about iron, ferropenic anemia, hemochromatosis, which is important to my family. So I hope you guys learned a little bit too, and I look forward to listening to your presentations as well.